Prostate cancer is said to be the #1 killer for men, but unfortunately, it seems information about the disease seems to be skewed only towards the deadly bit of it. Today, we are speaking to Dr. Digor Moses Dogbate, who is the CEO of Medimosis Prostate Foundation, to educate us more on prevention, treatment, and actually getting tested. So, quickly moving into it, there are two things that we should be aware of, not just prostate cancer.
Yeah, generally speaking, let's start with the prostate enlargement. Prostate enlargement comprises of prostate cancer and benign prostate hyperplasia. Let me explain. The benign prostate hyperplasia, what we call BPH, is the most commonest. That one, as you are born like a man, you are most likely going to suffer BPH as a man. As for the prostate cancer, uh, it's not as common as the benign prostate hyperplasia. The prostate cancer generally is about 5 to 10% of men who definitely get prostate cancer as they age in life. People with prostate enlargement tends to have certain symptoms, like they urinate frequently in the night. They cannot control themselves when they feel like urinating. They have that urgency to urinate. If you feel like urinating, you don't hurry up. You may soil yourself. And when they urinating, the flow, the pressure in the urine flow is slow. It comes slowly, and when they finish urinating, they feel as if there's still some left inside the bladder. And sometimes when you feel like urinating, you even get to the place you want to urinate, the urine delays before coming out.
It's almost like menopause for men, isn't it?
Yes, benign prostate hyperplasia, we call it papapause. It's like menopause. As you age as a man, you are likely to go through having benign prostate hyperplasia. The reason being that a hormone in a man, a male hormone called testosterone, has been implicated as the cause of the enlargement, the benign enlargement. So most men, as they age, from the age of 35 years or so, they will definitely go through the enlargement period. And then, as I was saying, when the prostate is enlarged, I was giving you some symptoms that comes with it. The urgency to urinating frequently in the day and also in the night. You strain whilst urinating. The urine doesn't flow as you want, so you have to push it before the urine comes. So these are symptoms of enlarged prostate. Now, these symptoms can go for the two, the benign prostate hyperplasia and also for the cancer. But in addition, when you have cancer, there are further symptoms that can be added, like you lose weight. You'll be losing weight, and you are not able to eat. You feel very weak. When you walk a short distance, you become very tired. You feel severe pain in the lower abdomen, also in the waist. Sometimes the pain radiates towards the thigh and then the leg. Your leg may be swollen. You may have constipation. You may see blood in your urine. These are additional signs that shows that you are likely to be developing prostate cancer.
You mentioned that it's something that starts from the age of 35. Now, is that when we start to get tested, or when should we start getting tested for prostate enlargement?
Yes, for prostate enlargement, I always advocate that you start testing from the age of 35 years or so. But if you have a family history, if your father had it, or your grandfather had it, or your uncle had it, you should start testing from the age around 27 years. About test it once a year. Make it your birthday present. On your birthday, go to the hospital, let them check your prostate gland for you every year. Make it your birthday present for yourself. It will help you. Yeah. Prostate enlargement is very, very common, and now it's increasing. I have seen cases as ages as low as 26-year-old man who have a very big prostate, enlarged prostate. The prostate has two cycles of enlargement: early puberty and after the age of 25 years or so. Then it starts enlarging. Then it continues to enlarge gradually as you age. The older you get, the bigger it becomes. So that when you are about 60 years, you are most likely to have the enlarged prostate. You may have enlarged prostate, which may not cause problem at all for a long time. It may be enlarged, but it will not cause any problem. But from the age of 50, 60 years or so, then the prostate may start causing problem for you. People have it earlier than that. As I was saying, if you have a family history, then you may start suffering from it. Even at the age of 40 years, you may start having problem with your prostate.
So then would it be advisable to say that people start getting tested from age 20?
20 may be a bit too low. 27, as our advocates, may be the average age from which, if you have a family history, you should start testing. If you don't have a family history, you should start testing from about the age of 35 years or so.
Yeah. Now, let's take a look at our lifestyle. You mentioned that our diet and other things are contributing to the faster enlargement of our prostate. What exactly are we referring to?
What we are looking at fatty diets. We're looking at a lot of fatty diet, junk food, a lot of meat intake, alcohol, smoking. These are likely to be risk factors that may propel the prostate to enlarge earlier than normal. But there are certain diets also that we take that will help to slow down the growth of the prostate. A lot of tomatoes is good for the prostate. It contains certain thing we call lycopene, which retards the growth of the stromal cells, the cells that form the prostate. It retards the growth. So there are certain diets that we take that are very helpful. Green leafy vegetables, green beans, cabbage, carrots, otomire, those green foods are all very good for the health of the prostate.
Now, what happens after you've gotten tested? The idea out there is you get tested for prostate cancer or enlargement, and the next thing has to be surgery.
Until the Moses Prostate Center came to the scene, and we are now offering a reasonable alternative, herbal alternative, which does not involve surgery at all. No matter how large the prostate is, no matter how big it is, we will not do surgery. We have a specially formulated product called PROSTATE, which we give to you, and it will shrink the prostate back to normal without any surgery. And so that the symptoms that you are suffering from as a result of the enlarged prostate go away. Every drug has side effects, mild diarrhea, which is also self-limiting, and it's easy to take. That's the only side effect.
Why was surgery the option before, and why is shrinking the option now?
Yes, the reason being that when the prostate is enlarged, let me give you a bit of the location of the prostate gland. The prostate gland is located directly under the urinary bladder, and then the passage of the urine will have to necessarily go through the prostate before reaching the penis. So the passage, the urethra, from the urinary bladder go through the prostate gland before getting into the penis, before the urine will get out. Now, the portion that goes through the prostate, as you age and the prostate enlarges, the enlargement does not go outwards, it goes inwards, which means that it tends to clamp on the passage of the urine, so it blocks the passage of the urine. That makes you have to strain before you are able to push the urine through the blocked passage. And so it's like a clamp on a garden hose. You clamp it like this. It's difficult for the urine to pass. So the surgery, the idea of the surgery is to take off the portion that is compressing on the urethra. We can take that off so that you relax the pressure on the urethra so that the urine can flow. Or you can take the whole prostate out. That's another surgery, total prostatectomy, or you can do transurethral resection of the prostate. That's the one I talked about. But we will not do any of those surgeries. We give you the product, the special formulated PROSTATE. You take it, it will shrink the prostate back to normal naturally, and then it will relieve the passage, and then you are able to pass your urine freely without any problem.
Okay, so now considering the fact that you mentioned that prostate enlargement is more like menopause for men, which means it's something that we are bound to go through.
Yes.
So then, can we start looking at the option where we remove the prostate from the beginning? Is that possible? Probably so that we even avoid the issue of having it enlarging and then having to deal with it.
Okay. You see, God in His own wisdom placed things in position for specific functions. The prostate gland has a very, very important role to play in a man's life, and it's a very important organ. It helps in reproduction. There are three, uh, let's say, the prostate, the testes, and then the penis. They are three musketeers. They work together. And so the prostate produces the fluid that you see, the prostatic fluid that you see after orgasm. What you see, the semen that you see with your naked eyes. That's what is produced by the prostate. That fluid has functions for the sperm. The sperm is produced in the testes, but they will have to travel and meet at a junction to meet the liquid that is coming from the prostate at a junction. And the prostatic fluid serve as a medium of transport for the sperm cells, and also serve as a source of food for the sperm cells to eat and to be able to have energy to swim across to fertilize the egg in a female for a baby to be produced out of it. So you don't take it off when, especially you are in your reproductive ages. It's very, very important. You cannot take it off. It's important for you. Unless you are above your reproductive ages, you don't want any child anymore, and you have the prostate worrying you, then you can take it off. The other thing you should know is that the prostate is like the hair. When you crop it, even when you crop sakura, you don't see any hair. The hair will come back again. The prostate, when you take it off, after some time, after a maximum period of 10 years, it will grow back again. When you take it off by surgery, it will come back again. It's like the hair. As long as you're alive, it will grow back.
What other things can we do just to be safe?
The things that I always advocate is that apart from the diet, the regular checkup, it's very important. The yearly checkup is important. When even you come to the hospital, you have a problem, we solve it for you. You no longer have any problem. The prostate is reduced back to normal. We also advise you to come back every 3 months to check again. As I was saying, it will grow back, it will become big again. So when it comes big again, every 3 months we monitor you. If it's coming big, we shrink it back to normal. We have cases where a lot of patients, we monitor them every 3 months. They don't have any problem, They come back 3 months, it's still the same. It's not growing back. Some 3 years, it's still the same the way it is. So it's good to be checking regularly. The checking is not expensive at all. What we do is we do what we call ultrasound scan. We can do abdominal ultrasound scan or rectal scan. We can do that. We also do what we call prostate specific antigen. And then we check at our hospital, Medimosis Prostate Center. What we do a thorough medical examination. We check your liver function test. We check your kidney function test. We check your urethra, your cholesterol level, the lipid profile. We check, we do a X-ray. We check a lot of things: your urine, your full blood count, your PSA, so that we get a base. So we check all this. It's not expensive. We do a thorough checkup for you. For a thorough medical checkup, it's about 200 cedis. For checking your liver function test, your kidney function test, your cholesterol profile, we do abdominal and the pelvic scan. We check your full blood count. We do a whole range of things, X-rays. All this about 200 Ghana cedis.
So then that's not very expensive if you're looking at what you're trying to avoid. Finally, though, when does a prostate enlargement become a cancer?
Yes, a prostate enlargement does not become a cancer. The cancer cells is a spontaneous thing. It doesn't mean that when you have enlarged prostate or benign prostate hyperplasia, it will tend to cancer. No, it doesn't mean that. We have people with very huge prostate, big size. I'm thinking that the normal size is 40 grams, but I have patients with about 400 grams, about 10 times the normal size. But when you do the biopsy, it's normal, it's not cancer. But I have people with a prostate gland, the weight of about 62 grams, and it's cancerous. You understand? So it doesn't matter if it's enlarged. It doesn't mean that you are likely to get it cancerous.
The likelihood of us getting a prostate cancer is very low, but the constant in this situation is that your prostate will enlarge as a man. So the best thing for you to do is to get tested, and when necessary, get the treatment. Just make it, like he said, your birthday present.